outside the cubicle, you will say the EGFR is low, all other parameters are normal, and the patient might be very well. The patient might be worried. Patient say that I came to general checkup last week because he is above 50, and maybe his wife told to go there and check for the diabetes. The patient might say that I might be having diabetes, and then he has no symptoms for the diabetes. He smoked 30 cigarettes, 30 years, drink alcohols for celebrations only. Do have leg, he do have joint problem. When you ask in meftosa, the patient might say that. And the patient would say, doctor, my joint problem is due to that I'm using cocodamol or maybe naproxen or ibuprofen. So these analgesia is using. And diagnosed 5 years ago, since he's on taking those medication, and he would be just generally fit and well. But when you will see do the examination, you might see the patient might be having high blood pressure. And you will see that patient may be having high blood pressure, and you mentioned urine dip, you might have some blood in the urine dip as well. And that time you will suspecting analgesic nephropathy. So this is an important scenario in which you will be suspecting analgesic nephropathy. And in the analgesic nephropathy, we would like to do that analgesic nephropathy because this is very, very top. If she doesn't agree to tell her partner, travel history, blood transfusion, drug abuse, we need to ask. Yes, you can ask about the tattoo. You need to ask about blood transfusion. You can ask about that. Definitely, you can ask. Yeah. Yes.
Yes, sir, I have a question. Like when there is a scenario, like in our mind, if there are 2 or 3 symptoms in our mind, there is a diagnosis already in our mind. Then we should go directly to the that symptoms are related to that thing, or we should exclude the other things, other
Yes.
diagnoses or other symptoms.
So, Asia, that's a good question. I would like to tell you, if you want to score high and if you want to pass PLAB-2, always follow structure. Score on data gap. Even if it's an error structure in which you already know, there is high likely you will fail that exam or that scenario in which you know the diagnosis beforehand. When you know the diagnosis, you act like a good actor that I don't know the diagnosis. You rule out everything. You'd be a safe doctor. You would ask everything which can kill patient. This is what they are expecting from you. Although patient came with the HIV positive, but you are a doctor. You should care about his today's health. How is he doing today? How is he feeling today? You need to ask. Even you can ask about social support as well. Who lives with you? How's that family? Given a thought. And if you already know that's a breaking bad news, at least start 4 minutes before, like at 4th minute, do the quick history of that. They will design that scenario, the calibration. Again, I want to tell you before the exam, the examiner do the calibration with the actor. You don't need to tell more things relevant. No to those, and just move to that. If you take detailed history and don't do what the structure is required there, the breaking bad news is already given to you outside the cubicle. It's a HIV positive. You have to follow that structure. Okay. So always score on your data gathering part. At least ask 6-7 short questions straight away, so that you definitely have some score in your pocket about the data gathering part. So data gathering part is good. For example, you have to ask about partner. If you was doing management, then you ask, do you have stable partner? If you would have asked before, you're not going back and forth. History done, then management only. Just this, don't go back and forth. So better to follow the structure. If you see the examiner, they would comment on that. Most of the students fail because they don't have a proper structure of consultation. This is one structure which you need to follow. So analgesic nephropathy. So I'll tell you that how do you score, and you need to score me on analgesic nephropathy. It's an important scenario, guys. I want you to understand the concept of analgesic nephropathy. The patient would be there, sent by wife, So he's 55 here. So patient, you will ask what question? Because this patient would say, my wife sent me for the diabetic checkup. She got pre-diabetic or something like that. And then you would start, what would be the presenting complaints for you? You would ask presenting complaint according to the blood result. The blood result shows the low GFR. So when it is the low GFR, you will ask facial swelling, leg swelling, high blood pressure. You will ask you also know the patient concern. The patient want to know about diabetes. Then do ask question about diabetes as well. You will tell them you don't have diabetes. Okay, but you need to ask urine symptoms. Why urine symptoms? Related to diabetes. First, related to diabetes. Urine symptom related to the kidney. Blood in the urine. Ask those questions. And bleeding from anywhere, or kidney, or burning pain, pain along your flank area on your tummy. You will ask all those questions. Family history of what? Kidney stones, kidney problems. You need to ask all those questions. And you need to ask on the past medical history. The patient might say, I have what? I have what? I have arthritis. And which medication? Then take whole drug history. You need to take whole drug history about the patient. And what drug history? You will ask about NSAID. You will ask blood thinners. Why blood thinners? Because the patient might having some problem with the blood coming, maybe in the urine dip. You might expect a blood because the GFR. When you ask about the GFR, you will see you know about outside the cubicle the GFR is low, and you will know that how to do that. But your history part should be very good. And in management, you would say, I would like to check your blood pressure. If you don't verbalize it, they will not give you blood pressure finding. And without that thing, without urine dip mentioning that, if you say I'm suspecting analgesic nephropathy, they might not give you good score because they will think you're robotic because you haven't done the full assessment. You have to do the full assessment. Then you will say it's analgesic nephropathy is a kidney problem caused by long-term use of what medication you are using. You will say that, and then after that you will do the what? You will